Cutaneous mycosis, dermatophytosis, ringworm, which is a disease of nails, hair, and the stratum corneum of the skin caused by fungi called the dermatophytes. Dermatomycosis, more general name for any skin disease caused by the fungus. Cutaneous mycosis, this is an infection of skin, hair, or nail caused by the group of keratinophilic fungi called the dermatophytes. Dermatophytosis, this is the tinea, which is ringworm. They digest the keratin by the keratonesis. They are resistant to cycloheximide, classified into three groups depending on their usual habitat. Cutaneous mycosis, they are keratophilic, which use a keratin as subject to live. Keratonesis, they invade only the keratinized layers. Classification, there are three groups or types. One is clinical, etiological, and the ecological. Infection, which is named according to the anatomic location, involved tinea corporis, that is a small lesion occurring anywhere on the body. Tinea pedis, which is the athlete foot, that is the infection of two webs on the soles of feet. Tinea unguium, onychomycosis, that is the nails clipped and used for culture. Tinea capitatis, that is the head frequently found in the children. Tinea barbariae, ringworm of the bearded areas of the face and neck. Etiology of the dermatophytes. There are three etiology. We can also call it as a genera: Trichophyton, Microsporum, Epidermophyton. Trichophyton, that is the infection on the skin, hair and nail. Microsporum, infection on the skin and the hair, not the cause of tinea unguium. Epidermophyton, infection on the skin and nails, not the cause of tinea capitatis. Trichophyton, which comes under the 19 species, affect hair, skin and nails. Trichophyton, for Trichophyton species, the infections on the hair follow one of four patterns. Ectothrics, more or less parallel rows of the anthrospores produced on the surface of hair. Small spored ectothrics, which is less than 5 mm in the diameter, caused by Trichophyton mentogrophites or the ruberum. Spores are about the same size as they produced by the aspergillus. Large spored ectothrics, they are caused by the T. vercusum. Endothrix, the growth inside the hair shaft only. Black dot, endothrix, the hair stubs filled with the arthrospore caused by the T. tonsrans or the T. verlicum. Flavus hair, the endothrix pattern of a damage seen on the surface of hair shaft. Trichobitum ruberum, the causes of the chronic infection in the patient with the cell-mediated immune defect. Microsporum, which comes under the 13 species, affect the skin and hair. Microsporum canis, most common etiologic agent of tinea. Epidermophyton flocosum, which affects skin and nails. Ecology of the dermatophyte. To determine the source of infection, they are categorized into three: anthropophilic, zoophilic, zoophilic. Anthropophilic, they are associated with the humans only, person to person transmission through the contaminated object, example M. O'Donnell. Zoophilic, they are associated with the animals, direct transmission to humans by the close contact with the animals, example M. canis. Geophilic, they are usually found in the soil saprophytes, transmitted to humans by the direct exposure. Dermatophytosis diagnosis. The clinical appearance is wounds lamp, UV 365 nanometer lab, direct microscopic examination. Dermatophytosis diagnosis. The culture is microbiotic agar, suberon dextrose agar, selective media containing the cycloheximide and the chloramphenicol. They incubate at the 25 degrees Celsius. The identification is based on the conidia. Diagnosis based upon the anatomical site infected, type of lesion, examination with the Hohn's lamp, examination of a KOH treated skin and scales from the infected area, and the culture of the organism, which is not too important. Microsporum, which affects numerous thick-walled and rare enough. They are rare in the microconidia. Epidermophyton, they are numerous and smooth-walled in the macroconidia. In microconidia, they are absent. While speaking about the trichophyton, the macroconidia is rare, thin-walled and smooth. While speaking about the microconidia, they are abundant. Thank you.